Hey everyone, thank you for joining the Behind Company Lines podcast. Today we have Andrew Headrick, founder and CEO of Kavira Health. Kavira is simplifying healthcare for patients. They are a full-service primary care clinic providing unlimited on-demand access to their providers via virtual care and home or house visits. Andrew, thank you so much for being on the show. I'm so excited to chat with you, and especially, I'm personally fascinated about, anything healthcare related, any advancements in terms of accessibility and giving people the care that they need. So it's always exciting to hear about what features or things you're enabling people to get. But also, I think one thing is always exciting to me is the red tape of healthcare, which a lot of founders talk about the difficulties in a legacy kind of industry. But I think it's so exciting in terms of the solutions that people are driving. So, but before we get into all that good stuff with Kavira, what were you doing before you started the company?
Yeah, Julian, thank you so much for having me. I'm really excited to be on the show today. So, before starting Kavira, I guess if we go back 5 years or so, I spent several years in investment banking, which is effectively advising companies on how to run their businesses, on how to buy and sell other businesses, and how to raise capital. So, while I was at Piper, which is the investment bank I was at, I was really able to take a look under the hood in the healthcare industry and see how these companies are thinking about strategy. Spent several years there, got really good experience, which I think gave me the intellectual understanding of what I wanted to do next. I left Piper and started actually a different company. It was originally called Evora, then called Fia Care, with a co-founder, and the idea was to basically truck in mobile dental equipment into corporate offices, set up in conference rooms, and provide dental care in the office. And the whole
Wow.
idea was, let's make people know that getting dental care is really important for us, but it's too inconvenient. So let's make it really convenient for people.
Yeah.
Of course, COVID hit and corporate offices shut down, and that totally put the kibosh on that business model. And so I actually still think that's a great business model if someone out there wants to steal it and is comfortable with, people being back in the office now. But about 2 years ago, a little more than 2 years ago, we pivoted. I split with my co-founder and started Kavira Health. Yeah, and that was the lead up.
That's incredible, and obviously, it's hard to hear that COVID kind of disrupted those business plans, but it seems like, the Kavira is really taking a leap in terms of providing that intimate and that necessary healthcare for their patients, and, what was the inspiration behind obviously, you were learning in, Piper about the intricacies of healthcare and how they run their businesses and things like that, but that doesn't mean you needed to bring people healthcare. What was the inspiration behind that accessibility and kind of following that, you know, I guess that particular aspect of healthcare?
Yeah, there were two, maybe three real big inspirations for starting Kavira. The first is I grew up in a big family. I have quadruplet younger siblings, which
Oh, wow.
means four kids that were born all at the exact same time. And I'm a few years older than them.
Incredible.
So as you can imagine, uh, basically on a monthly basis, one of the five of us would inevitably get sick. My mom would pack all five of us into the back of her super cool 1990s green Dodge Caravan. She'd drive us across town to the clinic where we'd sit in that stuffy, germ-filled waiting room. We'd probably cry obnoxiously. We'd have to wait for an appointment that was bound to start late. We then get 10 minutes with the clinician who prescribes medication. We go across town again, sit in the line for a pharmacy to pay for it all. There are copays, insurance hassles, surprise bills.
Yeah.
It was a huge pain in the neck, and it was really expensive. And so, from a really young age, I've kind of internalized just how inconvenient and expensive healthcare is. So that's the first piece. The second piece is, like I mentioned, I had that healthcare investment banking experience, and that gave me the intellectual understanding to realize that all the trends in healthcare have been moving in the wrong direction. People are getting sicker, costs are going up, life expectancy is going down. If you look at we're losing our relationship with our doctors, and if you look at the reasons why, people are basically saying talking to our doctors is too inconvenient and too expensive. And so I kind of got the understanding for that from an intellectual standpoint while I was at Piper, while I was at my last job. Um, and then I think also I guess I grew up in a family of business people and entrepreneurs. So my uncle
Yeah.
started and sold two healthcare companies. My brother was working at a health insurance startup in Minnesota that became a unicorn.
Wow.
We My dad was on the VC side, so I've been around this whole environment for a long time, and I was one of those weird kids that knew I wanted to start a company from the time I was 12 years old or something. So uh,
Yeah.
that's really where the inspiration came from.
It's amazing how you knew it the whole time, and it sounds like along the way you were just gaining momentum and experience, and I'm sure just insights into how to take on the challenge. I think a lot of potential founders who don't become founders, they end up stifling themselves because a lot of times experience breeds the next piece of opportunity, and it's just that momentum that can carries you through an idea in particular, and helps you kind of start and get going. But tell me a little bit about Kavira. How are you able to give people the full service primary care kind of experience, but in such an accessible way that honestly is just completely opposite of, I mean, my healthcare experience, I have to go to an office and figure out my provider network and do the whole song and dance. And to be honest, I haven't done a good job at it, but how are you able to do that? And what are kind of the boundaries to be able to do that? I'm sure there's probably things that, you know, don't want to allow you to be able to give people such easy access, or maybe they're not. I'm curious to hear about your take on that.
Right. Yeah. I think too many people's experience is looks a lot like my experience did 25 years ago, where we had to book days, sometimes weeks in advance, drive across town, sit in that stuffy, germ-filled waiting room. Appointments start late. Copays, insurance hassles, surprise bills, high cost. I think that's the norm, and so part of what is helpful here is that the healthcare industry is messed up, and and there's a somewhat low bar in terms of what we're trying to improve on. So how are we providing really convenient, really affordable care? Well, we sell our service as a subscription to employers. Employers pay us a per employee per month fee, and in return, their employees receive unlimited, on-demand, completely free access to our providers. Uh, we provide that access first virtually through an app on the employee's phone. They can call, they can text us, we can set up a video chat with a provider. And then next, if and when in-person care is needed, we're actually going to send that clinician to the home and provide care in the living room. In the home, we can do essentially anything that a typical primary or urgent care clinic can do. So we can provide rapid strep tests, rapid flu tests, in-home blood draws. We can even provide in-home x-rays. And so we're able to provide, this really convenient and affordable service. From a business model standpoint, the way we do that is we've stripped out all of the excess costs associated with normally receiving care. So we don't accept insurance, which is, a middleman that eats up some costs. That allows us to keep our costs a little bit lower. We don't we don't employ doctors. We employ nurse practitioners who in Minnesota have full scope of practice and are able to diagnose, treat, prescribe. We don't have a physical clinic location, so there's no overhead, rent. There's no lease costs.
Yeah.
There's no, no janitorial staff, no utilities, any of that. We've taken all of that away, and we're able to provide that really convenient care via technology, essentially.
It's amazing to see kind of stripping away and keeping the necessary aspects of the healthcare services and what you need in terms of kind of just day to day and regular healthcare. In regards to the nurse practitioner experience, I'm curious to hear about what's their experience with the platform. Are they kind of on call? How do they get the equipment? How do they get set up? And and active? Are they working multiple jobs? What does that network look like?
Yeah, our nurse practitioners are W-2s. They're employees, so they're not contractors, which means when a member reaches out to us, they're going to be talking to the same providers every time. So our providers will
Yeah.
start to develop a relationship with patients, which allows us to provide better care. Our providers, so in the traditional care system, providers spend about half their time providing care. They spend the other half their time essentially filling out insurance reimbursement, admin forms. Because we're not accepting insurance, that frees up a ton of provider time. It also allows them to do what they want to do, right?
Yeah.
They signed up to provide care. They didn't sign up to be filling out forms. So, uh, and then on top of that, our providers work from home. Our whole team is remote, which has really been enabled by COVID, right? So our team is spread out across the state of Minnesota, basically. And our nurse practitioners are working from home. They're running telehealth from their laptop. And then if and when in-person care is needed, that's when they close their laptop. They have 2 or 3 bags of supplies. They'll
Yeah.
go to the person's home and provide care in the living room. And I think providers really, it's not right for everyone. A lot of people like the feeling of working in a hospital, like, the camaraderie that comes with
Yeah.
that, that type of care or that type of environment. But a lot of people, also want to get out of the hospital. Hospitals, you're typically on your feet for a long time. You're working weird hours. There's a lot of bureaucracy, and we offer something different. People get to work from home. They get to work normal hours, and they get to see patients in their homes, which is fun. It allows them to see a different side of the patient and perhaps provide better care because of that as well.
Yeah, it's so fascinating to see, the change. And one thing comes to mind, and I don't know if this is a challenge you face, but how do the nurse practitioners kind of stay up to date with new practices or knowledge, or stay within, I don't know if there's any regulatory updates that you need to be conscious of, but how is educating kind of your main supply? It sounds like almost like a two-sided marketplace, right? Connecting pretty much providers with patients, and how do you maintain the, I guess, uh, the updates in terms of, the nurse practitioners and what they have to do, or is that something
Yeah,
you don't have to think about?
well, it is. It's much the same way that a traditional clinic works in that respect. So we have
Yeah.
resources, we have tools, some software that our nurse practitioners can check, and they can, that software gives us regulatory updates. It gives us updates on, RSV is spreading. It's the
Yeah.
flu is spiking. COVID is, the recommendations on how to treat COVID or how to think about COVID spreading are changing, and we get those updates through our software platforms. We also have advisors, so we have doctors on our medical advisory board who we can reach out to, who have some insight that
Yeah.
might help us provide better care.
Yeah. And in terms of just, it's fascinating after COVID, obviously people are working more remote, and are less, I feel like they're traveling more, but they're becoming to value their, day-to-day kind of time a little bit more effectively. What other trends outside of, dispersed remote working culture have really helped kind of get Kavira the momentum that's got recently?
Yeah, so totally right on the COVID piece. I think our society is moving towards on demand and delivered. You
Yeah.
can watch movies instantly on Netflix. You can get packages delivered same day, next day via Amazon Prime. You can call an Uber to come pick you up. You can get groceries ordered, etc. That is finally starting to make its way to healthcare. So I think that's our society is just primed for that. That's how we interact with the world today. So it only makes sense that that's how moving to healthcare as well. The next is the cost of healthcare continues to rise, way outpace inflation, and it is really starting to, be burdensome for most Americans, and so
Yeah.
that is helpful in a weird, obscure, in a weird way for us, because our whole goal is to provide more convenient and affordable care, and so people are starting to look for these solutions that solve that problem of high healthcare prices. And I hate that healthcare prices continue to rise, but because of that, people are starting to turn to solutions like Kavira. I think that the rise of telehealth is a big one. People before the pandemic, an astoundingly low number of people had used telehealth, and today basically all of us have used telehealth, and we've all become more comfortable with receiving care that way, and so that's a big one as well.
Yeah. What are some of the obviously you can't do surgery at home. I just don't think it's
Yeah.
an effective way of treating certain illnesses. But what are some of the other limitations that you've seen that either just structurally you can't necessarily do now, maybe in the future, or something that you just generally can't touch, like a surgery?
Yeah, I mean, we're never going to be able to provide surgery. At least, that's not where our focus is in the home as much as I'd like to. But we're constantly expanding our breadth of services. So recently, we've added behavioral health as a solution to our members. We've recently added those in-home X-rays, and we're looking at other solutions that would continue to expand that breadth. And what we're looking at is basically, what do people use a lot of? What can we provide virtually and in the home? And what's really expensive? What are those big cost drivers where we can help individuals save money?
Yeah, yeah. And tell us a little bit now that you have the company has been up and running for a couple of years now, and what's been great about the traction you've seen recently within this year, and then also what's kind of the excitement about next year, and what you have, and if you have any numbers to share. Obviously, we love numbers and we love statistics. So, yeah, how's the traction been, and what are you excited about for the new year?
We started Kavira. We launched the service about 2 years ago. We launched direct to consumer. It totally fell flat. We signed up, 10 people or something. We started selling directly to businesses and really got stonewalled there. We were able to sign up a few businesses, but most of the companies we reached out to either didn't respond or they said no. And what we learned is basically most companies add benefits through their employee benefits broker. So about a year and a half ago, we had our first meeting with an employee benefits broker. The reception was really positive. It did take some time for us to build up credibility. I was 28 at the time and had never started a healthcare company before, and this is a new concept. So I think people were looking at this like, very cool, but we'll wait and see. We're not going to be the guinea pigs for you. And it's really been in the last year that we have that credibility. We've been around for some time. The model is working. We have client references, and it's just started to take off. We're signing up more than a client a week, and we've been doing that for the last 6 to 8 months. So it's been exciting, and now the next we're on to what I kind of think of as the next phase. We found product market fit. How do we scale? How do we continue to provide a high quality service to our members?
Yeah, it's incredible, the different iterations to just finding. It's not even product market fit, but it's almost like the right partnerships to be able to kind of get you in the door and
Right.
get your
Yeah.
product
Those
adopted, right?
distribution channels.
Yeah, yeah, exactly. And w- uh, through those conversations, what is it that you learned about the healthcare in terms of like the providing system that was just
Yeah.
I didn't know that there were healthcare benefit brokers personally. And also, how do they benefit? What's their incentive to helping you get in the door with the client of theirs?
Yeah. So I didn't really either. I didn't realize employee benefit brokers are just such an important part of the healthcare system. They kind of sit in the background, but they know which services are out there and they know what employers need. And so they're the matchmakers that decide or provide the recommendations of what a company should add in terms of their health insurance or their other health benefits. And so they play a really pivotal role actually in our health system. And I did not realize that until a year and a half ago. one of the things that I've learned is that healthcare is a unique industry in the sense that the consumer is often not paying for the care. So the consumer is you and I. The person paying for the care is typically their employer. Their employer is making the buying decision on behalf of the employee, and they're making it in conjunction with an employee benefits broker typically. And what they're buying is insurance typically, and insurance is the one that is dictating how you consume the care. So it's a very, there's kind of a web, and navigating that web takes some inside industry knowledge to understand how that all works and what the incentives are for different groups. To answer your last question there, the incentive for the employee benefits brokers is one, I think that what we're providing is something that employers and employees desperately need. We talked about the high costs of healthcare. Again, our whole goal is to provide really convenient, really affordable, everyday healthcare. And that is hard to find. And so that's something that employers and employees are looking for, and we're providing that. And so that's the big incentive for the brokers, is that they're, basically able to provide a solution for their groups.
Amazing. And how do you would a company buy you in tandem with say a Blue Cross Blue Shield, Anthem, kind of another typical provider, or are you a replacement? Where is it like? Because I'm assuming some people may need more robust healthcare, depending on pre-existing conditions and things like that, where they maybe need a lot of or bigger network of doctors and things like that. So yeah, question is, do you work in tandem? Are you a replacement, or where are you kind of in the value chain for a consumer like myself if I'm picking benefit plans within my employer?
Yeah, so we are not health insurance, and we always highly, highly recommend that the employer does offer health insurance. So we provide that everyday care coverage. The health insurance plan will typically provide the catastrophic care coverage. So, if you go to the hospital, if you go to any place to consume care that is not our team, you're going to have to pay for it like you normally would. You're going to have to use your normal insurance. And so there's really three types of employers that sign up for our service. The first is really small employers that don't offer health insurance already, and Kavira is effectively a cost-effective everyday care benefit for those employers. The second is employers that offer a high deductible health plan. And so the high deductible covers the catastrophic care needs. Kavira covers the everyday care needs, and you're able to offer a fulsome benefit for a lower cost. And then the third, and this is kind of a technical industry term, but the third type of employer is what's called a self-funded employer. And basically self-funded employers bear both the risk of their population and they get the upside. So if their population is healthier, or if their population is not going to the doctor as much, self-funded employers actually benefit. And so self-funded employers add Kavira as effectively a cost containment strategy.
Got it. What's some of the biggest risks that Kavira faces today?
Yeah, I think one of them is we're scaling right now, and how do we just making sure that we continue to execute, that we continue to hire the right people, that we continue to do the right things, that we continue to make the right decisions as we grow. I think that's a big one. The next is the market that we're in. Healthcare, I think, has been kind of a stodgy industry for a long time, but especially with COVID, that's changed over the last decade. And then especially with COVID, that's really changed. There's been a lot of money thrown into the industry. There's a lot of innovative startups that are taking a crack at providing more affordable, more convenient, a lot of different, there's a lot of different angles to come at here, but people are really trying to disrupt the industry. And so it is a pretty hot space right now, as we're all aware, and competition is pretty fierce. And so how do we continue to stay relevant? How do we continue to make the right decisions? How do we continue to stay on top of the trends so that we're doing a good job of providing care for our clients and the employees that we cover?
And if everything goes well, what's the long-term vision for Kavira?
Yeah, would love to. So right now we cover, it's hard to know, but probably about half of the population in Minnesota. We could, they're not members today, but we could provide care to about half the population in Minnesota. So we have a fairly extensive geographic reach within the state. We'd love to continue to expand within Minnesota, and eventually we'd love to go national with this. So I think we've proven out that the model works in Minnesota, and let's start to bring this really convenient, really affordable care to the rest of the country.
What will it take to get there?
Just continuing to put one foot in front of the other, continuing to execute, continuing to do the right things, and then I think we have the right relationships. We have those distributors in place in Minnesota, and then how do we choose the right next market, and the market 2 through 5 after that, and then continuing to choose markets that are amenable to this new care model, and distributors that will help us get there.
Amazing. As a founder, I was personally, how do you kind of get through the ups and downs and the challenging things that take building a company mentally? I don't know if there's advice that you would give another founder, but right now I don't believe you have a co-founder, so there's a kind of a Batman Robin, um, you know, a setup there with a lot of those relationships. I personally have one. I would love to think I'm the Batman, but I'm the Robin, unfortunately. But no, but all in all, just out of curiosity, what keeps you motivated? What keeps you reinvigorated and continuing? And honestly, what do you do to recharge and kind of stay on top of your own?
Yeah, well, I'd be lying if I would say it was if I was saying it was easy or not stressful. It is hard and stressful, and it's a constant challenge. And I think that's true of any entrepreneur or any business leader. A lot of it is just making sure that I'm taking care of myself, making sure that I'm eating well, that I'm taking care of those relationships that I have with my family and my friends, making sure that I go on walks and think through things. I write a lot just to make sure I get my thoughts out on paper. Try and work out when I can, because I feel way better when I do.
Yeah.
I listen to a lot of podcasts, a lot of audiobooks, and that I think helps. I don't have a co-founder, but I think that helps me think through things. And then I have a lot of mentors that I talk to, that I bounce things off of. I talked about how my whole family has been in business and in the startup space, and that's been just incredibly helpful. I'm really blessed there.
Yeah, it's awesome, and I think a lot of founders talk about the network and then and the different ways to just like take your attention onto something else, just for even the moment, to relax the mind on what you're working on, and it always reinvigorates maybe even a new idea or a completion of a previous idea that was incomplete. So it's always cool to ask what strategy you deploy. If you weren't working on Kavira, what would you be doing?
Oh man, probably back in finance is my guess.
Yeah, I love that. And what's particularly hard about your job day to day?
Um, so what's weird about being an entrepreneur, I think, or unique, is that you don't have a boss. There's no manager. There's no one telling you like, this is the to-do list. This is what the plan is. This is, what needs to get done. I'm the one that is making that up as I go.
Yeah.
I need to, analyze the market, talk to our customers, talk to our members, and make sure that we're providing something that is continually valuable. And then, if we're not, or if there are areas that we can improve on, I need to be the one that is putting together that blueprint and the next steps for how to do something better. Now, that is not to say I'm not trying to take credit here. I also have an amazing team that is incredible in so many ways. They're great to also, they're talking to our members, and they're getting ideas, and they're adding services and helping us to provide this high level of care. But I think that's from my point of view, that's probably the hardest, is just how do I how do I come up with those ideas for myself, and then how do I sit down and execute them?
Yeah, incredible. And I appreciate, I know we're close to the end of the show, and I always like to ask this question, not only for this next question for selfish research purposes, but also for the audience as well. Whether it was early in your career or now, what books or people or now even podcasts have influenced you the most?
Oh man, yeah, so many good ones. So for books, my favorite book is Atomic Habits. Have read it a couple of times. You're nodding your head. Have you read Atomic Habits?
No, no, I've heard the recommendation so many times that I'm gonna find the audiobook on YouTube. Um,
It's
probably
a
this
good
week.
one. Yeah, the premise is basically that our whole life, our life trajectory is made up of the little habits that we have, good or bad. And so, how do we make those good habits really easy and enjoyable? How do we make those bad habits really difficult and unenjoyable? And if you can just continue to uh, make a little bit of progress every single day, that really adds up. Your trajectory is going to be pointed in the right direction, and you're going to, over the course of months or years or decades of doing these good things and making sure that you're not doing those bad things that are setting you back, you're going to see huge progress. And that's been that totally changes the way that I think about the world, the way that I think about the things I do on a day-to-day basis.
Amazing. Well, Andrew, I know we can go into so many different topics, especially within healthcare and building and scaling and growing, but we're here at the end of the episode, and I'm gonna have to do a version two of a lot of these episodes because I think there's more things to discuss. But the last little bit is I always like to give our guests a chance to give us your plugs. What are your websites? Where are your LinkedIn's, your Twitters? Where can we get involved and be a part of the mission? And if I'm maybe a VC or somebody who wants to work with you, where can I reach out?
Yeah, it's all Kavira Health. So Kavira Health. You can reach us on our website, kavirahealth.com, LinkedIn, Kavira Health. We have an Instagram and Facebook as well. So would welcome anyone reaching out.
Love that. Well, Andrew, I hope you enjoyed yourself, and thank you again for being on the podcast.
Thank you so much, Julian. Really enjoyed it.
Of course.